My name's Aaron, and I'm a board certified critical care paramedic. I'm going to talk to you today about when 911 fails to arrive and the EMS staffing crisis in America. Imagine calling 911 and being told no ambulance is available for 40 minutes. In New Orleans, a 4-year-old's family lived this reality as her airway swelled, units were tied up. It's important to support our EMS as we face a crisis in staffing shortages. We need to support it with funding, wages, and improving working conditions so when somebody dials 911, help arrives. Everyone expects a fast ambulance when a life is on the line. Shortages are widespread, they're not isolated to one city. This is a crisis that the entire United States faces. Unfortunately, these shortages lead to delayed response times, and sometimes an ambulance doesn't come. What I'll show you are the scope and causes of the EMS staffing shortage, the life and death consequences for the public, and the practical actions that the public can support, such as funding, policy, and respect. Many agencies cannot keep crews fully staffed due to high turnover and vacancies. This predates COVID-19, but it was certainly worsened by the pandemic. Professional groups confirm a sustained workforce crisis in EMS. The EMS staffing shortage crisis are rooted in low wages, chronic stress, competition from other hospitals, and weak retention pipelines, also opportunities for advancement. EMS comes with an immense amount of responsibility and schooling that is very challenging. Equivalent positions typically pay much more, such as becoming a nurse versus a paramedic. Also, witnessing these really traumatic events and dealing with it in a way that is autonomous without the support of hospital staff, if you work in a profession that's typically in a hospital otherwise, causes a lot of stress, leads to burnout. New Orleans example that I gave earlier, calls stack up, response times lengthen, and outcomes worsen. Things like cardiac arrest, stroke, etc. are very time-sensitive emergencies that require rapid transport. Investigations show hour-plus wait times in major cities, which have crucial consequences to those patients and those families. Also, rural agencies are oftentimes reliant on volunteers, and sometimes those volunteers are not available to answer calls. All of this. We have overworked clinicians, communities that are losing trust in 911 when no ambulance arrives or doesn't arrive in time. And we owe EMS professionals a sustainable careers and support that align with their level of responsibility and training. EMS is not designated as an essential service, and that's very unfortunate. Services such as the police and fire are essential services. Another thing that's odd about EMS is that it is under the Department of Transportation. That's something else that needs to be changed. By establishing it as an essential service, it will receive the funding that it needs. It'll stabilize that funding and it'll help so we can offer sustainable wages and we can hopefully hire on the people that we need to complete this job. Also, improving reimbursement for ambulances is another big thing. Insurance companies sometimes don't reimburse for ambulances at all, which means that the bill falls on the patient, and or ambulances bill in an otherwise odd structure if it is interfacility transport, to where the ambulance doesn't really generate income for that hospital, which means that the ambulance service actually costs money. They keep it because it is a necessary service, but it actually hemorrhages money. These are the things that need to be changed in order for us to stabilize funding to ensure that we're getting the staffing that we need. Second fix is to build and keep the workforce. We need to raise that base pay. That'll help us to retain EMS professionals and attract new ones. Tuition and forgiveness programs also help. That's something that is sometimes in place at local services now that helps to create more paramedics versus EMTs. The cost of the schooling is much higher for a paramedic. We need to have robust mental health and wellness programs for the EMS professionals, such as peer support systems and other things that can help them deal with those traumatic calls, which helps with retention. Also modernizing roles in communities such as paramedicine, which is a fairly new concept. It is not something that's widely used in the United States currently. There are some states that do utilize it. It is most similar to an at-home health nurse, but its main purpose is to keep those frequent flyer patients that keep coming to the hospital within a 24-hour period for the same issue to the emergency department from coming back. Instead, we see them at home. We make sure that they're med compliant, that they're getting what they need. And this helps to overall reduce the burden on those emergency departments, the hospital system, but also EMS systems. So ways that we can help, we need concrete nonpartisan actions. Support our local EMS with funding measures. Contact your state legislators to designate EMS as an essential service. Respect the profession. Simple things goes a long ways. And public education as well. Learning CPR so you can help save a life and help reduce that workload on the EMS professionals when they do arrive. And also using 911 responsibly. By knowing what a true medical emergency is versus something that is not a true medical emergency, that you could probably drive yourself to the hospital or understand when to seek emergency care versus an urgent care, for example. Bottom line, it's important that we fund EMS, that it is designated as an essential emergency service, and that we invest in it. The staffing crisis is solvable, in my opinion, but only if we act now, and it is getting worse day by day. So please stand with EMTs and paramedics so they can stand with you. Thank you.